Hi, we are health educators from the Wellbeing and Health Promotion Department. We want to start the presentation by welcoming you to SDSU. We are thrilled to have you become part of our community. Part of getting acquainted with a new community, whether on campus or off, is to be an active member. The first step of becoming a part of your community is getting to know it. At SDSU, we have a campus-wide wellness initiative that brings together health, wellness, and well-being services and departments called Live Well Aztecs, leading the way to well-being. You may have heard of it. Today, we will highlight some of our departments and services we believe are vital to understanding your community in a bit more detail. The Capulli Center is located across from the big E&S field and next to Viejas Arena and Fraternity Row. Most of the wellness resources we will discuss today are located in this building.
The first department we will discuss is student health services. The student health fee is part of your tuition, so you have access to student health services. We have great professional staff that are here to help you with all of your primary care needs. This does not take the place of health insurance, but should be used in addition. Our staff includes doctors, nurses, nurse practitioners, and medical assistants. There is a pharmacy on campus, and they have cheaper options for over-the-counter medications. There's also a lab. This is where tests are done, both in-house and some are sent off campus. The best way to get in contact with Student Health Services is by calling them to make an appointment. You can find their contact information on the SDSU website or by Googling Student Health Services SDSU. Healthy Connection is the online system for booking appointments, obtaining test results, and emailing your medical provider. There is also the Wellbeing and Health Promotion Department, which is located on the 3rd floor. Their staff includes 4 health educators, a community resource specialist, and the economic crisis response team. They focus on outreach events, presentations, and education on campus. Health educators provide free one-on-one health education sessions on topics such as alcohol and other drugs, nutrition, sexual health, and sexual violence prevention. The community resource specialist can help you access services off campus using your own health insurance coverage or help you obtain health insurance. The Economic Crisis Response Team, or ECRT, helps students that may be experiencing hardships related to housing, food, or financial crisis. We also have students who receive course credits to become peer health educators. They engage with students about health topics and help them make healthier choices. Don't forget to check out Wellbeing and Health Promotion online on the SDSU website.
Counseling and Psychological Services is also located on the 4th floor of Capulli. Services and appointments are free. Take advantage of this service. It's not something that you will have free at other points in your life. They offer individual and couples counseling as well as group workshops. Active Minds is a program that gives students first-hand experience working in the mental health field. Safe Zones is an LGBTQIA+ allied training designed for students that are interested in learning more. You do not need to be in crisis to use counseling and psychological services, but you should definitely take advantage of them. Call to talk to a counselor over the phone or to make an appointment and get connected to services. You can find their contact number and more information about what they offer online through the SDSU website. There is also the University Police. Their office is located next to the Peterson Gym across from the Aztec Recreation Center. If you don't have this number on your phone, please put it in now. However, if you call 911 anywhere on campus, it will go straight to them. They are a regular police department, just like the San Diego City Police Department, but they have chosen to work here at SDSU. They want you to have a positive relationship with them, and they want to have a great relationship with students and are happy to chat as long as they are not on a call. There are many reasons why it's important to familiarize yourself with these resources. You should know that they exist. SDSU is now your community, and there are incredible resources here for you to utilize and take advantage of. You can help others by passing on this information. Be that person that can help someone out. If you know about the resources available, then you can refer your peers and community members to these resources. We see seniors every year who didn't know about our services, so please be aware of these and be quick to mention them to your friends.
So we just talked about using these resources and helping others by linking them up with the resources they may need. But we want you to do more. We want you to do more than just help with referrals, but also get involved and intervene when you see a problem or emergency situation unfold. We're going to switch gears a bit here so we can better understand getting involved and intervening. Now, whether you are on campus or off, there are situations that arise where you have to decide to do something. So what is a bystander? Basically, a bystander is exactly as it sounds, someone who stands by and does nothing. Now, there is a very prominent psychological theory called the bystander effect. The bystander effect states that the greater number of people standing around and doing nothing, the likely an individual is to get help. So why don't we help? So we just talked about this prominent theory and why it happens, but why don't we help? What would prevent someone from getting involved in a situation or intervening? Many of us have had most likely experienced a time where we should have stepped in but didn't. Maybe you felt weird, or it could have been seen as socially inappropriate, or the person might have been embarrassed if you helped. You might be worried that you are misinterpreting the situation and the person doesn't need help.
So as we explained, this effect has been heavily researched, and psychologists have come up with 6 factors that make the bystander effect more likely to happen. First is the diffusion of responsibility. When there are more people around, you may feel less responsible. In other words, responsibility is shared by more people and less falls on you. Depending on others for social cues. Humans depend on each other for social cues for almost all of their actions and responses. So it's not surprising that if nobody's cueing you to act or do anything, you may likely assume you know something you don't know and follow their lead. The assumption that someone else would call for help, or that someone else will step in and take care of the issue. For example, a car on the side of the road. You might assume help is on the way, which may or may not be true. The ambiguity of the situation. The situation may be ambiguous and you don't know what to do, if you should do anything, or if there are potential risks or harm to you if you do intervene. Trust your instincts. Feeling that it's socially inappropriate to act. It could feel very weird to help someone when everyone else is standing there looking at you. The tendency to misinterpret the seriousness of a situation when nobody takes action. It is easy to downplay the importance of what's going on when nobody else is doing anything.
Let's discuss some intervention strategies and the steps you need to know when intervening in a problematic situation. The first thing you should do is evaluate the situation to determine if it is an emergency or a non-emergency. An emergency unfolds quickly and requires an immediate helping response. Someone is in a life-threatening situation. Maybe someone gets seriously injured or someone has alcohol poisoning. In emergencies, we know to call 911. Something is happening right then and you need to get help immediately. So in comparison, a non-emergency situation is a slowly unfolding event that allows you for less time for you to plan your intervention. A non-emergency can be something that may turn into emergency later, but is pretty much anything that isn't a problem and that doesn't fall into the immediate emergency category. This allows you some time to think about how you want to intervene and give you some time to plan. Let's move on to the next step, which is deciding how you want to intervene. There are 2 ways to intervene: directly intervening by talking to the person, or engaging directly, or indirectly intervening by eliciting the help of others. What are possible indirect interventions? It could be talking to staff, RAs, or even friends. Do know that faculty, staff, and RAs have all been trained on how to deal with sensitive issues, and you can always go to them when you need help or know there's a problem, but don't feel comfortable being the person to intervene yourself. Now, after you've decided the situation is emergency or non-emergency, and if you want to directly or indirectly intervene, You have one more choice to make about how exactly you're going to intervene. The two primary ways to intervene are to either shift the focus or shift the person. Shifting the focus is looking for ways to intervene that will disrupt what is currently heading in a bad direction. This is typically used when the circumstances of the situation are the problem. So for example, if there are a ton of people drinking at a party and it's out of control, you could hide the alcohol, and that would be shifting the focus. Shifting the person would involve educating the other people in order to change their thought patterns. For example, if you were concerned about a friend who was drinking too much, you would maybe cut them off that night or distract them, but the next day you would sit down and talk to them about it being potentially an ongoing problem. Shifting the focus is more circumstantial or situational, where shifting the person is about trying to alter their thinking or behaviors. You can remember this information by thinking of the 4 Ds. Direct, so you respond directly to the situation, go up directly to the aggressor and stop the potentially bad or dangerous situation from unfolding. Distract either the perpetrator or potential victim with a conversation or an activity. Be creative and use your best judgment. Delegate. Bring in a third party to help. This is good for situations where you feel unsafe to intervene alone. Delay. If you can't do anything in the moment, check in with a person after to offer support and resources.
Okay, here we have our first scenario. You are out with friends. One friend in particular had a hard week of midterms. You know that they've been looking forward to letting loose this weekend. They told you they pre-gamed pretty hard and continued drinking well into the night. At some point, you start to notice that they seem to be getting out of control and drinking way too much. You are having fun and don't want to leave, but realize you may need to get involved at some point. So would you consider this an emergency situation? Okay, so this scenario is probably not an actual emergency at this point. But what would be the signs you are concerned about that would lead us to think that this has changed into an emergency situation? Maybe your friend has become unresponsive, has cold, clammy skin, shallow breathing, or is vomiting. If you notice these symptoms, call 911 and lay the person on their side, often known as a recovery position, and do not leave them alone. Now let's go back to the actual situation. So this is not an emergency, but what would you do? Consider your approach to the situation and their possible reaction. Okay, another scenario. Let's discuss some different party scenarios that you might come across. So here are situations that you may come across at a party. Do you think this is an emergency? Now, this doesn't look like an emergency, but would you intervene at this point? What would cause you to feel like you should intervene? Maybe a partner is being aggressive. Maybe the partner is pulling away. Maybe the partner is expressing unease either verbally or non-verbally. Or maybe the partner appears to be leading the person away from the group, maybe even forcefully. So what do? Get them apart and check in. Now, how do you get them apart? What exactly do you say? What if you don't know them? Would you still just interrupt their hookup? Is there an indirect way to help them? Another example, someone that has had too much to drink is being helped away from the party. Is this an emergency? Why or why not? Now, of these pictures, which is most concerning? It's hard to determine. With no context, we should treat them all equally. If you don't know, you need to find out. So what could you do or say? Maybe use an excuse such as, hey, you forgot your phone, to buy time and get a friend help. If anyone is ever swaying, slurring their words, or overly intoxicated, it is best that you do not let them go home with someone because they are very likely too intoxicated to consent. But we want you to feel motivated to check in with people when something feels off.
Scenario 4. Your friend tells you they have experienced a sexual assault. So what would you do if someone discloses to you? It's important to listen and believe. they are already upset, make sure you're there for them and do not ask questions such as, are you sure? Were you drinking? What were you wearing? Be a good friend. It's important to give them options and resources. There are many resources on campus that could help. This includes the University Police, Counseling and Psychological Services, Student Health Services, the Title IX Coordinator and Deputy Coordinators, and an SDSU Sexual Assault Victim Advocate. You can also use this website to locate resources and connect others with the support services for victims of sexual assault. sdsutalks.sdsu.edu. The final step is to let them choose what they want to do and support that decision. There are many different responses to sexual assault, and it is not your place to pass judgment on someone or on what they want to do about the assault. You need to give them options and let them drive the choices. Scenario 5. You are concerned about a friend. They've not been attending their classes, have been hanging out with friends less and less, and seem to be withdrawing from the things they used to enjoy in life. Is this an emergency or non-emergency? Well, it could be either. So what are we concerned about here? Depression, mental instability, possible suicide. What would you do? How would you intervene? Maybe you could pull them aside and talk to them. Invite them to do something social. Now, this may be counterintuitive, but psychologists say the best way to talk to someone who you think may be suicidal is to directly ask them. You could ask them a question such as, are you thinking about hurting yourself? Or are you thinking about killing yourself? Now, this is awkward, but you are not putting the idea in their head, and you will not be pushing them in that direction. They will likely respond with either, well, yeah, a bit, and then open up, or say something such as, no, not at all, but I have been feeling sad. It feels uncomfortable to just say it, but if someone is really struggling and it has crossed your mind that they may be thinking about it, then the best thing to do is directly speak to them about it. Now, what if they don't seem suicidal, but you still think they need help? You can refer them to counseling and psychological services. You can also call counseling and psychological services and talk to a therapist about advice on how to approach someone and get examples of language to use to help them. This brings up a very important point. We've talked about the bystander effect, and we understand that the more people, the more likely the effect is to take place. Now, we're a community of over 35,000 students, so it is very likely to take place during your time at SDSU. You may think to yourself, well, I don't know this person that well, or they have friends that will step in. That is how people fall through the cracks. So please help those who are in need and reach out and step in whenever you can. And if you don't feel like you can do so, indirectly intervene by getting someone you trust to help out. Let's all strive to make this a healthy and safe community. Here are social media links for all of the services we just described, such as Wellbeing Health Promotion, Counseling and Psychological Services, and SDSU Police. Like our Facebook page for more information, health tips, and finding out more about upcoming events. Thank you for attending our presentation, and welcome to the SDSU community.